Hello everyone, my name is Elisabetta Mancinelli and I am an European specialist in zoological medicine, specialty small mammal medicine and surgery, and I work for Valley Veterinary Hospital in Cardiff, a referral hospital with a dedicated exotic team. This is Merlin. Merlin had a general anesthetic yesterday for a ear surgery, and I would say the general anesthetic had some complications which only the skills and preparation of our dedicated team of exotic nurses managed to overcome. So I thought I took this opportunity to discuss about general anesthetics in rabbits, which is often quite challenging for vets in first opinion practice. So I will discuss about my personal experience and give you some information based on evidence-based medicine as well. So I hope this will be useful, and I also take this opportunity to thank Vets4Ukraine for giving me the opportunity to participate to this great opportunity for helping our friends and colleagues in Ukraine. I hope to see you soon on the 9th of May at 8 p.m. and we will be discussing about general anesthetics in rabbits. Thank you.
Good evening, everyone, and welcome back. It is a while that we are not talking. This is our 19th meeting with our 19th webinar. I'm Daniela Murgia from Vets4Ukraine2022, one of the specialists that together with now nearly 30 have joined the forces and decided to organize this amazing initiative of webinars made by vets, for the vets, for veterinary students and for veterinary nurses. The aim of our webinars is to raise funds to help the British Red Cross to deliver support as assistance to Ukrainian people in crisis and difficulties because of the war. And therefore we are offering these webinars on different topics, topics on obviously veterinary medicine, anesthesia, oncology, internal medicine, surgery, ophthalmology, made by different specialists in their respective disciplines. And these webinars, I was saying, are for free, and you can access these webinars on YouTube. If you go on the Veterinarian channel, you just need to register, and then you will have access to all the previous recorded webinars. We also go live, or we are going live on LinkedIn, Facebook, Twitter, and again on YouTube. Why do we do this? Because we would like to invite you to help us in raising funds for the British Red Cross. So therefore, please, first of all, I would like to ask you to share our link because we want to reach as many people as possible. So please share to all your friends and colleagues at work and your family. It is very important that you share our initiatives because in this way we can reach many people, and these many people could donate even a little amount, because every little counts. So if you have the financial possibility to make a donation in exchange for these amazing free webinars held by specialists. Today we have seen in the countdown at the beginning, we have seen that the guest and the speaker of today is Elisabetta Mancinelli. We will have her with us pretty soon. Elisabetta is a diplomate of the European College of Zoological Medicine, and her specialty are exotics. And I was very excited to know that Elisabetta would have joined us talking about anesthesia in rabbits, which is a very important topic in an everyday general practice. Before giving the word to Elisabetta, we have organized, we have decided to show you a video because we don't want to talk about only about veterinary medicine tonight. We want also to talk about an important initiative, of an important, let's call it, attitude. So I'm talking about hospitality. Hospitality is nowadays a very important concept, and the video that I would like to show you is a video about, let me introduce it, is about a disaster that happened in 1986 when I was actually a child, and it was when the generator 4 in the central, so in the power, how can I say, in the nuclear power plant in Chernobyl exploded, and there was a diffusion of radioactive substances in the atmosphere, affecting Ukraine, affecting Russia, and also part of Europe. And following these initiatives, you might, for those of remember these events, there were many children and also adults affected by cancer. So since then, in particular Italy, but I'm sure also many other European countries have organized like hospitalities for children. So until now, they have been like up to 500,000 children that were hosted in Italy for a month by families, just to give them the possibility to stay in an environment, a non-polluted and non-radioactive environment. So I would like to ask Paolo to launch the video, and then I will explain you why we have decided to show you this video. Paolo, please, let's go with the video. So why we have showed you this video? Because right now a colleague of us, a vet and also a manager called David Giraldi, he with a group of his colleagues and in particular vets partners have organized a similar initiative of hospitality. So right now in Italy, they are hosting veterinarian colleagues coming from Ukraine, so flying from out from from Ukraine, and they have also organized an important fundraising for these people. So I don't want to spoil too much. So I think I would like to allow David to tell us of this very important, amazing, great initiative. So I would like to ask Paolo to introduce David Giraldi and Elisabetta Mancinelli. So we are here, Elisabetta. Hi, Elisabetta. How are you?
Fine, thank you.
Welcome, welcome. I'm so grateful for you joining us with an amazing talk on anesthesia in rabbits. And here we have David. David, you are on mute.
Yes, I am. Hello, good evening, everybody. Hello, and hello, Elisabetta.
Hello, hi.
So before, Elisabetta, if you don't mind, I would like to ask David to introduce and to talk about this amazing initiative by Vet Partners. So as I was mentioning, David is a vet, so is a colleague of us, but he's also the CEO of Vet Partners in Italy. And among the many titles that David has got, is also a certified holder in practice management. So, David, amazing initiative you are doing, you have organized. We have spoken over the weekend, and I've personally met 2 of the Ukrainian colleagues that are currently hosted in Italy and helped. Would you like to explain us and tell us about this initiative?
Yes. So first of all, thank you very much for inviting me to this beautiful project that you are directing with Paolo. It's an honor and a pleasure for me to be here. For me, this is a very important moment because I believe that people should get together to organize initiatives like this. There's a lot you can do alone, but if you do it with other people with similar-minded, vision, intention, you can get much bigger results. So you mentioned that I've got a general practitioner certificate in practice management. Now that show me, that if you build a skill in talking to people, organizing people, you can get great things done. And what we did was simply decide to do something about what we care. Sorry, I got a slight problem here. Okay, can you see me now? Yes. And we decided to try to get into an organization to be more effective in what we were doing. So I did a research at the beginning of the war, and I discovered that the Italian Association of Veterinary Surgeons got in touch with the Ukrainian Association of Veterinary Surgeons, USAVA, and this was advertised basically by you and the other organizations that were trying to do something. So I got in touch with a representative, and he explained me what was happening and the needs at the moment. My goal was to try to get in touch with some local organization in order to build a bridge, trying to help our colleagues, because that because we are similar, then that activates our best intentions to help. But the aim was trying to help the families in the most effective way. So instead of doing something, that positive, like donation, what we wanted to do was to give these people the possibility of having a shelter, of having the possibility of just stop and regroup and regain some kind of peace before reorganizing themselves. So what we did was to offer our organization in order to give shelter to families. And at the beginning, we thought that we could invite over families, and I did the first bit. And now I am very lucky to say that personally, we have this group of 9 people represented, for example, by not just our colleagues, but also we have the grandmother, and you think about the people, but within the people you have the kids, so who's looking after them and what's happening to them. And then you think, Okay, so the vets can do something to help themselves, but what about the grandmothers? What about the elderly? What about the disabled? So the idea was to find a way to have our colleagues over, make sure we provided, the basic of hospitality, but also a job for the adults and for, particularly in this case, the vets, but also the schools for the children, the health help for them. Some of them got problems related to things that are typical in Ukraine. We got a couple of people that are positive to tuberculosis, for example. They need assistance. And the grandmother, the grandmother needs an orthopedist. So that is the idea of giving an integrated help in order for them to restart a life in another country, are waiting for their country to finally restart again. So that was the general idea. Please.
Yes, I think, as I mentioned, so this is a great initiative, and I'm really, so I think it's very well done. I don't know many persons that have that are managing to organize something like that. I have a practical questions, because these colleagues coming from Ukraine do here in the UK, they need to convert their veterinary diploma, so they need to be authorized to work in the UK, and I'm sure this is also in Italy. So how is the procedure? What do they need to do to be able to work as veterinarians in Italy?
Yeah, so one thing is the willingness to help. The other is to organize the help. Now, in this particular case, there are regulations. There's a council directive in Europe. So there are laws that states that because of the general situation, because of the war, these friends of us have rights. And the right is to have their qualification recognized in Europe. Now, obviously, one thing is the European regulation, the other thing is the local regulation. So if people are listening to us from different countries, it's all possible. It's nothing too complicated. It's just a process to set. It's very important that you set the process right in the right country. But, all this is published. And if Paolo, please, can show the first slide and then the second, I've got the links that you can use, and we can discuss a couple of practical cases. So I'm waiting for this. So this is the scheme we have used, the process. And first of all, what we want is to give hospitality and again, give peace to these people, to these friends, in order for them to recover. Whilst we start the integration process, which the first bit of it is pretty much the health support because of COVID or because of other health-related issue, and then support them into the bureaucracy and regulation system. So in each country is different. Once you set up the process, there's obviously long intervals before everything is done and achieved. And therefore, you got to give some kind of normalcy to their life, which means basically the kids back to school and, starting the language courses that we do, or in the local council, depending on the country. But basically, I hear that in each country, the state has organized all sorts of initiatives to support them. And then with particular regards to England, there are organizations like Vet Partners that you can, if you show the third slide, Paolo, please. In the third slide, you can see there's, we have this address in the UK, for example, where our Rob Williams is in charge of the office that will give complete assistance to our Ukrainian colleagues. So if they write to Rob Williams, we have a system where these friends are basically, we give them hospitality and then assistance throughout the process, the visa, all the necessary documents to be able to work in the UK. Or we do the same in Italy, or we can do the same with other associations, but talking about ours, in each country, Germany, Switzerland, Spain, France, we have local offices where we can help setting up, the hospitality and the rest of the process. For example, we have a colleague that will move from Ukraine to England, and she will have all the necessary help, not just to find a job, but also eventually to be prepared to have other opportunities like specialized internship, residency, whatever is necessary. So A, hospitality, B, career, and possibility to rebuild a life. That's what we do. That's what we're trying to do.
Is there anything that we as vets specialists that do not belong to vet partners can do to help and support?
Yes, I believe all of us can do a lot more. What we can do is first give shelter, help them through the process, be able to give them the dignity of having a job and provide for themselves, which I think is the most important thing. Lots of these people are very proud people. So the ability to have a job and go to work, that's the first step. The second one, we can help, and this is what, for example, the President Uzava is asking, is give the opportunity to our colleagues to build a career, which means, continuous professional, training, the possibility to have access to university referral centers. So build expertise towards, further education and specialization. I believe, but, maybe it's a little bit too early. I believe that by having the degree validated, equal opportunities, simply converted, they have theoretically the possibility of having access to further qualification. Obviously, it's early stages. They have temporary refugee status, which will last for a year. So it pretty much depends what happens this year, what happens in their country. So there are things yet to be discussed. But what I can say, from what I hear and by what I can read, is a huge humanitarian movement towards these people. Hopefully, this will also help other kind of refugees. So we do have to remember that we have Ukraine, but we have also other situations where, maybe we can help more, or we can, again, create systems and processes that you can use in different situations. So I think, albeit terrible, we are learning a lot on how much we can do, how much we can help other people in, having a share of what we're lucky to have as a community, particularly as vets, because vets, like to help. We are built to serve other people, and not just the pets, but also, families and people in general. So I think we have a lot to give. And this is just the beginning, I believe.
Absolutely. I could not agree more, even because we are in a very fortunate situation here at home with our families, with our pets. So compared to other situations, in particular right now in Ukraine, and it's very easy. It's very easy. And now I'm talking to who is on the other side of the camera. It's very easy to help. So you don't need to make things like David is organizing, or you don't need to organize a lecture with specialists as we are doing. You just need to, for example, to donate a tiny bit, so what you can, and you don't even need to donate it to us. You can donate to any kind of initiative. Uzava has many sites where you could donate. By the way, if you want to help us helping our friends and brothers and sisters in Ukraine, you can click on www.justgiving.com/Vets4Ukraine. Just a little bit, because as I always say, a little bit helps. And the magic word of today is really hospitality. we are certainly well aware that not everyone can give hospitality to other people, but for example, a reality that I came into contact the past weekend is yes, we want to help them, but for example, think about people in need or veterinarians in need in Ukraine that need to or have to flee or go away from their country, and they want to move to a different country like UK or Italy or Germany, Switzerland, Spain, whatever country, but they really don't have the money to travel through Europe, for example. And this is during a conversation, just, oh, well, I'm talking about to these friends or to this colleague, and how can I help you for your career and so on. And then I just thought, wait a moment, she's thinking to move somewhere else in Europe, and I said, but do you have the funds to do that? She has to move her family, her pets. So do you have the funds to do that? And the answer was, I'm really struggling. So just think about if you know someone that lives in Ukraine, a vet or anyone from Ukraine that is in need to move away from to leave their country. Maybe just think to ask them whether they need a little bit money for the train, for the flight, for whatever, for the car, for the fuel, and this can also be a big help. Yeah. So David, thank you so much. I really appreciate your that you have joined us in this campaign. I think everyone can do, can be a part of it, and all together we make a huge, what we are doing is a huge effort, and I like to call it as a cultural movement now.
Yes.
So it's not only doing webinars by Vet4Vets, it's also something bigger, something that has more meaning behind it. I think I've spoken a lot, and Elisabetta is waiting and waiting. But before, Elisabetta, apologies for that. Before letting you start with your webinar about anesthesia in rabbits, I just would like to, I don't know if people remind Valeria Olinik. Valeria is the wife of Alexei Olinik, the Ukrainian colleague that unfortunately died following a bombing while he was serving his country. And Valeria, when we saw her appeal, Valeria was still in Ukraine. Now Valeria managed to move and was in Dublin, or is in Dublin, and she has sent us nice images of like a march that has happened on the 8th, so yesterday, on Sunday. And Paolo, do you want to show us the images that Valeria Olinik has sent us to share with our friends, please?
Thank you, Daniela. Thank you. Thank you.
Thank you, David. So these are the images. So Never Again is now 8 May 2022, yesterday in Dublin, and there was really a march against the war in Ukraine. And here on the right side, you can see a photo of Valeria with her daughter, and she has left here her email address in case you know that Valeria has not asked for donations. It's just, I'm doing this spontaneously. You know that using PayPal, you can donate money to help people using the email address. So now I think is the time for Elisabetta to talk. So don't forget to share the link so that many people can follow Elisabetta webinar. And don't forget to donate if you like her webinar. And yes, I think I should now be silent and leave the word to Elisabetta.
Thank you very much, Daniela. And I would like to take the opportunity as well to thank you for inviting me, because it's an honor to be able to participate to this initiative of Vets4Ukraine 2022. So it gives me the opportunity to, sort of help or make my little part into this, opportunity in this initiative to help friends and colleagues. So thank you very much for having me, and thank you very much to everyone that took the time to be here tonight, and whatever you can donate, or as little as you can, or as much as you can, because every little helps.
So it's a pleasure to have you here. It's an honor for us. Thank you. Thank you.
Thanks.
Let's talk about rabbits now, because we are all very interested.
So, Paolo, can you send the?
I think you need to launch the presentation.
Yeah.
So with the sharing.
Yeah. Let me see if I can. Computer. Can you see it?
Yes. Fantastic. Yes.
Perfect. Right. So thank you very much, everyone who once again took the opportunity tonight to be present because of the initiative, and because obviously rabbits are really cute as well. So why rabbit anesthesia, first of all? Rabbits are now the third most popular pets, at least in UK, after dogs and cats. The last estimate we had was about 900,000 pet rabbits kept as pets within the UK, with about 2% of the adult population owning a rabbit. On top of that, the last numbers also showed that quite a large percentage of owners were in agreement with the statement that owning a pet, and in particular rabbit, made them stressed. Now, why this is the case? Rabbits are a very peculiar species, obviously, if we compare them to dogs and cats. And this is not just for owners, which often are not prepared for the needs of these species. This is not a cat, this is not a dog, and certainly is not a small horse, even if there are some similarities to horses as opposed to dogs and cats. But rabbits are often very challenging to vets in practice. And this is the reason why I chose rabbit anesthesia. This is probably one of the most common questions I get from colleagues. How do you anesthetize rabbit? How can you make them survive an anesthetic? Which is your preferred protocol? So we'll try and discuss all of these during the talk, and I'm very happy then to take any questions at the end of the talk as well. Now, just a very brief disclaimer. Now, I'm not an anesthetist. However, I am an exotic vet, and in particular, I am a rabbit vet. I am specialized in small mammal medicine, and this is what I've been doing for the last 10-15 years. So I will try to bring my experience to you, obviously coupled with some information taken directly from the available evidence-based medicine. So we'll discuss some papers, for example. We'll try to take advantages of some paper to then get some practical tips to then apply to our everyday job. So first of all, why anesthetizing rabbits is different? Why is it so challenging compared to anesthetizing dogs and cats? First of all, the size. Now, obviously, dogs and cats are of variable size. You have small dogs, bigger dogs, whereas with regards to rabbits, there is generally some sort of uniformity. The majority of rabbits that we see in practice are between 2 and 3.5 kilos on average. Obviously, there are smaller breeds, 1 kilo, for example, and there are larger breeds, for example, continental giants that can even reach 7 to 8 kilos. But generally speaking, this is quite a wide range of sizes. In terms of behavior and husbandry, obviously dogs and cats are predators, and because they've been pets for quite a long period of time, generally speaking, their husbandry is much better compared to rabbits. Rabbits are prey species. They are masters at disguising signs of disease. meaning that by the time we realize that something is not quite right with them, usually the disease state is much more advanced than what we thought initially. So it means that often owners miss early signs of disease, presenting the rabbit as an emergency when in actual fact the problem had been going on for quite some time. Simply the rabbit had not been coping with that problem anymore, starting to show signs and symptoms of disease. Typically, rabbits are neglected as well. We know the Rabbit Welfare Association campaign to improve rabbit welfare, because unfortunately, despite being so common, they are often misunderstood. We don't understand that they are a social species, that they are kept in smaller enclosures. And this can definitely impact on their well-being. They can impact quite significantly on their general health status as well. Anatomy and physiology. Now, as opposed to dogs and cats, we know that rabbits have a very large digestive tract. They are herbivorous species. They are adapted at digesting large amount of very fibrous food. The reason being that they are obviously prey species. They need to run fast away from predators, and therefore they need to digest and keep the digestive tract relatively light. They have a weaker cardiovascular system. Just think, for example, of the smaller coronary system as opposed to dogs and cats, and the susceptibility to catecholamine. Rabbits are very prone to stress, and stress can have a really serious negative impact on a lot of organ system. And you imagine the impact that this can have on a rabbit that has underlying health problems as well. And then finally, response to pain. We'll have a small chat about pain in rabbits as well, but often rabbits do not show pain as we are used to detect pain in dogs and cats. It's very difficult to understand whether a rabbit is in pain or not. We often don't know the extent of which they are in pain, and therefore treating their pain is very difficult, meaning that this can lead to complication, especially when we are discussing a general anesthetic in a rabbit. Diagnostics. Now, in dogs and cats, because the advances in veterinary medicine, these species have been going on for a long time, we often have a series of blood tests, for example, and other diagnostics prior to a general anesthetic, which help us to understand the general health status of the patient prior to anesthetizing the patient itself. This is not often the case in rabbits. Often we don't have many information about how the rabbit is doing before anesthetizing it. They may be less effective. We may be able to have maybe a blood test before anesthetizing a rabbit, if any, especially in first opinion practice. And therefore, this may not allow us to understand how sick the animal is before a general anesthetic itself. And then obviously staff training. This is very important because unfamiliarity with the species can have a great impact on the outcome of a general anesthetic. Nowadays, there are certifications available for exotic species, small mammals in general, for example, as well as other specialties. But this is a relatively new thing. It's not as diffuse, as available as the qualifications available for dogs and cats. We also have a special board of anesthesiologists for dogs and cats. This is not the case for exotics and for rabbits in particular. So a specialist in small mammal medicine is at the same time a clinician, a surgeon, and an anesthetist as well. And therefore, the disclaimer is in that I am a vet, I am a specialist, but I am not an anesthetist. I've got practice, I've got experience in rabbits, and I've learned from that experience. I read a lot about the literature available, and this sort of gives me that increased confidence that certainly helps me to deal with these species. And then obviously we need to discuss about intubation and intravenous access. These are relatively routine in dogs and cats. You don't need basic training. I could intubate a dog or a cat even if I haven't seen in practice a dog or a cat for over 10 years. This is not the same for rabbits. Intubating a rabbit is definitely possible, but it takes practice. The anatomy needs to be understood as opposed to that of dogs and cats. And the same is for the intravascular access. It's relatively easy to do when you get practicing. So as far as you are able to do this more and more often, then you'll be able to understand that this is easily done and should be done whenever a rabbit is anesthetized. So which are the main challenges when we are dealing with rabbits in first opinion? This talk is aimed at first opinion vets and nurses, as well as anesthesiology residents that may not be familiar with the species, and to those that would like to increase their familiarity with the species, that would like to deal with rabbits a bit more confidently. We already mentioned that rabbits are prey species. They tend to mask clinical signs of disease very efficiently, and therefore this needs to be taken into consideration. They may be more sick than what we think they could be when we examine them and anesthetize them. The impact of stress on rabbits can be significant. Now we know about feline friendly practices. These have been, more and more frequent, in our everyday job, and they are aimed at reducing the impact that stress can have on the feline patients. This should be the same for rabbits as well. Rabbits are prey species, therefore, for example, should not be kept in the same waiting area as dogs and cats, because this can impact significantly on their well-being, can impact on some of the organ systems which are essential for during a general anesthetic. So every attempt should be made to reduce the stress from the journey to the stay during the hospital procedure, and to allow then a safe return home. That's the reason why many colleagues, for example, push in having a rabbit admitted to the hospital prior to a general anesthetic, even the day before, allowing them sort of to get used to the new environment, rather than having them the same day of the procedure. So having them caught by the owner, transported into the car, into a very unfamiliar environment where, for example, dogs and cats have been barking for an hour before they are admitted to the hospital, and that, for example, the anesthetic is planned for the afternoon. This is a very long period of time during which this prey species is subjected to unnecessary stresses that can definitely impact on the potential outcome of that anesthetic procedure. Another thing to remember is that rabbits are small mammals. They have a very high metabolic rate. They have smaller glycogen reserves, meaning that some of the complications can occur much faster than in other species. For example, they are more prone to develop hypoglycemia for relatively short period of anorexia or reduced appetite. Higher metabolic rate means also that the metabolism and excretion of certain drugs is faster compared to dogs and cats. So direct extrapolation from another species to this one may be done with certain caution. Obviously, it's difficult in some cases because we don't have all the information, all the pharmacokinetic and pharmacodynamic information that we have for dogs and cats may not be available for the species. However, often there is the experience of other colleagues, so it's important also to reach out to other colleagues that may be more experienced in using certain drugs before directly extrapolating from one species to another that have completely different anatomical and physiological characteristics. Some drugs may have a shorter duration of action. For example, think of certain analgesic. So it's important to make sure that this is not done incorrectly, or the drugs are used correctly to avoid then incurring, for example, in an appropriate analgesic plan. They have also a higher oxygen consumption rate, meaning that some complication may occur faster, especially during a general anesthetic, but also means that time for intervention is much shorter in this species. So the time that you have to respond to some complications, to an emergency, may be much, much shorter as compared to what you would have in a dog or a cat. So we discussed about evidence-based medicine, and this is one of those studies that can give us important information, important insights into peri-anesthetic mortality rate in rabbits. This study was conducted in quite a while ago, almost 15 years ago, if I'm not wrong, and looked into the mortality rate of rabbits into the peri-anesthetic period, and looked at different variables that may have been connected to this mortality. Now, the study was run across different centers in the UK and looked at 8,209 rabbit anesthetic procedures, so quite a large amount of, good solid data here to look at. Now, the mortality rate was approximately 10 times greater compared to that seen in dogs, and the risk of deaths in rabbit was about 1.39% within the 48 hours from the anesthetic or the sedation procedure. When they looked more at numbers, this meant that approximately 1 in 72 anesthetized or sedated rabbit died. When the authors looked at the different variables that may have they may have been correlated with this mortality, they noticed that there were some variables that may have been in a way not controlled. For example, the ASA grades or the extent or the of the surgery, if it was an emergency or not. For example, with concerning the ASA grades, healthy rabbits had a smaller chance of dying under general anesthetic as opposed to those that had increased ASA grades, so 3 to 4, where the risk of mortality was much higher. So obviously, rabbits that had underlying health problems that were unstable had a higher chance of dying during a general anesthetic. There were some variables, however, that could have been controlled. For example, when they looked at time of induction between 9 a.m. and 12 p.m. as opposed to 12 p.m. to 9 p.m., then they noticed that the mortality rate increased significantly when the procedure was scheduled later during the day. So this is something that we can control. For example, trying to schedule, and we are talking obviously about those elective procedures that can be planned in advance. We're not talking about emergency. We can't obviously predict when an emergency is going to arrive, but for those elective procedures that can be planned, it may be better to plan those procedures as early during the day as possible to allow the rabbit to then recover during the following the general anesthetic. Also, mortality increased with increased duration of the general anesthetic, and we'll discuss about this later, but preparation may have a significant impact in reducing the anesthetic time. So we'll discuss about implementation of checklists, for example, and preparation is ultimately the key for success. Another more recent study was published in July 2018. However, collected data in a different time frame between 2009 and 2016. Is a slightly different setting because we're not talking of a multi-centered study, but we are talking of a single-centered study in a university setting. The authors looked at the peri-anesthetic mortality as well as the gastrointestinal complications in pet rabbits. A total of 210 procedures were counted during this period. Out of these 210 procedures, only 6 rabbits died. 4 died during the first 72 hours, following the anesthetic procedure. So the overall anesthetic related mortality at 72 hours was approximately 4.8%. When they looked then at peri-anesthetic gastrointestinal complications, about 77 of these 204 anesthetic events, where obviously we're counting those events where there were no deaths, the peri-anesthetic complications reached an incidence of 38%. Authors then looked at the variables that may be associated with the mortality, for example, the ASA grades, whether they were elective procedures or not, tracheal intubation, and these were their results. Important to notice is that 37% of the rabbits undergoing the general anesthetic had tracheal intubation, so something that definitely can be improved from that point of view. And then 70% of the deaths were occurred for cardiorespiratory complications. And this was something similar to what the other authors of the previous study found. The majority of the rabbits or anesthetic-related deaths in rabbits occurred within the 3 hours following the anesthetic procedures, and the majority were due to respiratory complications, so something we can definitely work on. Now, it is important to remember that we do have a lot of research in laboratory settings, so based in or performed on rabbits which may not necessarily reflect the situation of the domestic rabbits. So there are major limits when these researches are performed in lab rabbits, and direct extrapolation of these researches into the domestic field may not be appropriate. Which are these differences? Obviously, the size. Remember that the majority of these researchers use breeds like the New Zealand white rabbits, so generally larger size compared to the breeds that are generally seen in practice. The anatomy, for example, being a larger breed, they may have bigger ear vessels, so easier to catheterize compared to that of a Netherland dwarf, for example. The age, many of these rabbits used for research are very young, and this definitely does not reflect the rabbits' the average age of the rabbits presented to a veterinary practice. Stress obviously is a completely different environment. The rabbits are acclimatized, they are kept in specific and controlled conditions. They're usually disease-free, so there may not be those concurrent diseases that complicates the general anesthetic in a domestic rabbits. And obviously, we have a different situation with regards to the carer, the personnel that is looking after these rabbits as compared to an owner. The owner are usually, obviously it depends on the cases, but owners may be more attent in some cases. So it's a completely different situation. And often in research settings, postmortems are not performed, so it's very difficult to prove an anesthetic-related death. Another difference that comes to mind now is the fact that in many of these researches, the drug dosages that are used are very high, so may not be applicable or directly extrapolated into a domestic settings where different principles, for example, balanced anesthesia protocols are recommended nowadays. So I just mentioned the concept of balanced anesthesia because this is one of those things instead we generally directly take from other species like dogs and cats. So the concept of balanced anesthesia originated to use drugs or to provide the same element of anesthesia, so unconsciousness, immobility, muscle relaxation, reduced autonomic response to noxious stimuli, but using multiple drugs at lower overall dosages. The reason for this is that by doing this, by using multiple drugs but a lower overall dosages, we actually reduce the impact that the side effects of these drugs may have on the cardiovascular system, therefore promoting cardiovascular stability. And this is something that definitely we should aim in doing in rabbits anesthetics as well. Another important thing to consider is the pre and post anesthetic care of our rabbit patients. We've already seen with the previous studies that morbidity and mortality increase with increased duration of the general anesthetic. So it is important to get ready, to be prepared in advance. So for example, this means getting the patient prepared, ready before the general anesthetic is induced, getting all the equipment that is required for a certain procedure ready before the rabbit is anesthetized, checking the machine, checking everything that will need to be used during the procedure in advance, so that when the rabbit is anesthetized, the time of the general anesthetic is reduced to a minimum or as much as possible. It is also important to make sure that the rabbit is suitable to be anesthetized. So diagnostics, wherever possible, should be always encouraged. And it is always important to, guided by these diagnostics, whenever possible, to stabilize sick animals. So to provide, supportive care for example, anorectic patients, patients that are dehydrated. So obviously correct all those factors that may result into further complications during a general anesthetic, and to provide adequate supportive care, in the post-anesthetic period to allow the patient to return to baseline parameters. Which are these baseline parameters? Obviously, simple things like respiratory rate, heart rate, body temperature, probably not talking about blood pressure, but ideally the blood pressure, but it is rare to be able to collect this parameter in an awake patient prior to a general anesthetic. How do we collect this data? Simply performing a complete physical examination. Obviously, you record the body weight to allow determination of the volume of the drugs to the correct level. It's important to give not a smidge or a little bit of that and a little bit of this, but to calculate the exact dosage of the drugs needed for that specific patient. Why collecting or performing a complete physical examination to collect the baseline parameters is important? Because obviously you may be unfamiliar with the species, so consulting a textbook to verify the reference range of physiologic parameters in this species is very important. However, have a look at these reference ranges, which are taken from a normal textbook, one of the very common textbooks used for rabbit medicine. If you look at the heart rate, for example, there is quite a massive range between 150 and 300 beats per minute. It's a very wide gap. So where is your patient standing, in this gap? So that's the reason why you want the baseline parameter, because that tells you the state of your patient at that exact time, which is time 0. And this is where you aim to return to at the end of the anesthetic procedure, at the end of the recovery phase. So those baseline parameters that we determined at the beginning of the procedure when the physical examination was performed will be monitored throughout the general anesthetic, and the aim is to return to those baseline parameters that we determined at the very beginning of the procedure. So some further pre-anesthetic considerations. We've already mentioned stabilizing debilitated patients. This reduces massively the risk of incurring into further complications during a general anesthetic, and this means correcting fluid deficits, correcting hypothermia, correcting hypoglycemia whenever indicated. Obviously, hypoglycemia, hypothermia, these are already negative factors, so some negative predicting factors in the survival in rabbits. So anesthetizing a patient that already has these negative factors is something that obviously may lead to quite expected complications. Whenever possible, we discussed about collecting pre-anesthetic bloods, even blood gas analysis. There are nowadays reference ranges for blood gas analysis in healthy and diseased rabbits. So whenever possible, this is something that certainly can improve the amount of information that we can collect about that patient, and that can be used throughout the general anesthetic to monitor the performance of that patient as well. Fasting. I know that this is something routinely done in dogs and cats, but is fasting appropriate for rabbits and small mammals in general? Now, the answer is that overnight fasting is generally not recommended for several simple reasons. First of all, rabbits cannot vomit, so fasting to reduce the risk of vomiting is therefore not necessary. Rabbits have smaller glycogen reserves, meaning that they are more prone to develop hypoglycemia even after a short period of anorexia. Therefore, fasting can increase the chances of them developing hypoglycemia and then incurring in further problems. Fasting is often made or is often encouraged to reduce gastric volume and cecal volume, because this may impact or theoretically impact on the breathing, especially when the rabbit is held in dorsal recumbency. However, remember that the rabbit's stomach is never empty, even after 24 hours of fasting, and therefore the reduction in stomach volume and cecal volume is probably of limited value for what we are trying to achieve. We can overcome this possible compression of the large gastrointestinal volume onto the chest by simply raising the chest compared to the abdomen. So assuming what is called, and we'll see that later, anti-Trendelenburg position. And this can be done really easily by rolling up a towel on the back of the patient, so underneath the chest, so that the chest is kept elevated throughout the procedure compared to the abdomen, therefore reducing the impact of the large abdomen onto the chest. Short fasting, and I'm talking about of a couple of hours, may simply be done to clean the mouth, the oral cavity from the food material containing it, but it simply can be done, while you are preparing the patient and the procedure. So it does not need to be a very long fasting, and water should always be available at any time. I usually tend to withdraw simply the pellets, but leave hay available at all times. And then again, we've mentioned very shortly preparation and implementation of checklists. Now, there have been, I'm pretty sure, a few human studies and the equivalent veterinary studies looking into the usefulness of checklists. There is in particular one human study which suggested that the use of short checklists can reduce the risk of certain complication and reduce human error, as well as death rates in patients undergoing specific cardiac procedures. The same veterinary study showed that implementation of checklists can reduce the risk of certain complications from occurring, for example, esophageal intubation, errors in calculating drug dosages, as well as allowing early identification of problems and therefore their immediate correction. So this is something that I tend to do routinely in my clinic. The checklist don't need to be something very complicated. It's usually one page where the patient is obviously identified to avoid any problems in misunderstanding the patient. There are often rabbits with the same name, so it's important to have the correct patient in front of you. And may also include, for example, checking all the equipment, the anesthetic machine, getting all the drugs already checked, drug worked out, local anesthetic, analgesic, as well as emergency drugs. It's important not necessarily to draw up the drugs, but certainly to work out the volume of the emergency drugs that may be required, may an emergency occur, and obviously get all the equipment required for intravenous or intraosseous catheter placement. Intravascular access, we've just mentioned the possibility of placing or intravenous or an intraosseous catheter, obviously preferring the intravenous catheter in a routine situation. The intraosseous catheter is simply limited to emergency. Either way, intravascular access should always be available for any rabbit undergoing sedation or general anesthetic. This is because it doesn't just allow the delivery of the anesthetic drugs themselves, but it'll allow us a more rapid response should an emergency occur, as well as the possibility to inject different drugs, for example, antibiotics if needed. And they also provide an efficient route for replacement fluids, not just during the procedure, but in the postoperative period as well. If we are providing CRI as well, an intravascular access is fundamental. The ASA grades. I'm pretty sure you are familiar with the ASA grades. So what it is simply a classification system defined or that was implemented by the American Association of Anesthesiologists, a classification system for the human patient physical status. So this does not equate directly to a classification, a risk classification for that patient. However, used alongside some other risk factors, for example, the unfamiliarity with the species, the familiarity of the surgeon or the anesthetist with the species, other factors, for example, the availability of certain equipment, facilities, as well as the type of procedure, being it a routine or emergency, can certainly allow identification of risk factors and can allow, predicting somehow the perioperative complication and therefore the outcome of the procedure. But itself, it does not necessarily predict the outcome or the possible complications of a procedure. Now, obviously, rabbits generally are between ASA grades 2 to 4 when they are anesthetized for a specific procedure. And this is because often a normal healthy patient is not necessarily a healthy patient. They may have underlying problems, so it's something that always needs to be taken into consideration when anesthetizing them. So let's get to the interesting part, the anesthetic protocols. So there will be a slide in which I will present the protocols that I use, but this was just an introduction to say that there isn't a best anesthetic protocol for rabies. There isn't something that works better compared to another protocol, and there isn't a study that compares a different protocol to look at which are the complication or which are the best outcome, depending on the protocol used. Many different drugs may be used. These are some of the ones that can be used in the pre-medication phase. They can be given intravenously, intramuscularly, or subcutaneously. I tend to prefer those medications that may have a reversal agent, such as alpha-2 adrenergic agonists, such as dexmedetomidine or medetomidine, or midazolam, for example, for which I can use flumazenil. Fentanyl as well is another option, although I don't tend to use particularly, the anesthetists may have completely different ideas. This is simply preference, personal preference. So it doesn't mean that this is not good. It's simply, this is not a drug that I tend to use very often. And then how do we induce? Obviously, depending on the protocol, a drug may be administered intravenously, so it may be a completely intravenous protocol, may be given intramuscularly or subcutaneously. Induction may be used with an inhalant agent. However, this is not something that I would ever recommend in a rabbit. It's something that is routinely done in rodents, for example, but should not be performed routinely in rabbits. And why? Now, as I said, I am not an anesthetist, but this is what I found simply looking at the available literature. Mask induction in rabbits can cause stress, can cause panicking, injuries, breath holding, hypercapnia, hypoxia, and bradycardia, as well as sudden death in rabbits. So it is not something that should ever be done in rabbits. Isoflurane or sevoflurane can be used as a maintenance agent, but should not be used to induce a general anesthetic in this species. This is just a few studies that have been performed using either isoflurane or sevoflurane for induction of anesthesia in lab rabbits. In one study, using or comparing sevoflurane versus isoflurane, most rabbits struggled violently during induction with both drugs. In another study that compared isoflurane versus disflurane, rabbits underwent a long period of apnea, and they also showed bradycardia, hypercapnia, and hypoxia. And in another study, these drugs caused a severe cardiorespiratory depression when used at 4%. So it's something that it should not be recommended, it should not be performed in rabbits. There are nowadays, other drugs that can certainly be used as opposed to isoflurane or sevoflurane for anesthesia induction I'm talking about. And obviously maintenance using inland agents, either sevoflurane or isoflurane, is routinely done. Always remember that this gas anesthetic can increase the end-tidal carbon dioxide and reduce the pH, can also induce respiratory depression, so we should aim, whenever possible, to reduce the maintenance concentration, the flow rate, to a minimum, and this can be done several ways: by providing an adequate level of analgesia for the procedure that we are performing, and by using, for example, local regional anesthesia. This is something, and you can look, for example, at the dates of these studies that I found for you with regards to local regional anesthesia in rabbits. That is relatively new in rabbit medicine. Rabbit medicine has evolved massively over the last 10 years, and we are starting to realize that this is something that we can definitely take from the dog and cat world and apply to a rabbit anesthesia as well, because it can improve the well-being of the patient during a procedure, can reduce the amount of isoflurane and sevoflurane that we are using to maintain the patient under general anesthetic. So I would strongly advise you to try to read at least some of these studies to get more into the use of local regional anesthesia. So which are the blocks that are often performed in rabbits? I listed the most common ones here. The ones that I tend to use more often are the maxillary nerve block, the inferior alveolar nerve block, obviously when I'm performing dental procedures, depending on the procedure. And then when ear surgery is performed, then more recently I started doing auricular nerve blocks, in particular the greater auricular and the auricular temporal nerve block. And there is a very interesting study published on veterinary anesthesia and analgesia regarding the anatomical location and the anatomical landmarks for performing these nerve blocks in rabbits. Something that I haven't done so far, and obviously some of my limitations as well, sciatic femoral nerve blocks and brachial plexus nerve blocks or epidural, but is something that obviously whenever an anesthetist is available should be performed more routinely in rabbits as well. Another important thing that I tend to use more and more often in rabbit medicine is constant rate infusion, and I strongly advise you to get hold of this very interesting review article published on the Journal of Exotic Pet Medicine 2020, Constant Rate Infusions in Exotic Animals. This is a very interesting read, but it's very useful because it gives the dose rates of many of the drugs that can be used in rabbits as CRI. So we're often at the beginning, when I started doing constant rate infusions, for example, of ketamine or lidocaine, I was very unsure of what drug dosage to use. This article came extremely useful for the purpose, because it allowed me to gather, those information that are very difficult sometimes to find in the available literature and directly applicable to our everyday job. So let's come to my preferred anesthetic protocols. This is the first protocol, and obviously we are talking about standard, routine, elective procedures. These protocols can be altered, can be modified depending on the procedure that I'm going to be performing, but as a general rule, I tend to use dexmedetomidine associated with buprenorphine or methadone, depending on the expected level of pain of the procedure, and then use alfaxolone as an induction agent. Remember, dexmedetomidine is a good sedative, but it can result in hypoxia, so oxygen administration should always be provided. And then alfaxolone, I am a big fan of alfaxolone, but alfaxolone should be used with great care because it can result into apnea, especially if given too rapidly. It should be reportedly given over a 1 minute period and to effect. excessively rapid administration of afaxolon could result in apnea, and it does. And therefore, if you're not ready to intubate the rabbit, this can prove, detrimental to the patient. So always be ready to intubate the patient when you're using afaxolon. And then obviously, I generally tend to maintain with either sevoflurane or isoflurane. We tend to switch initially from sevoflurane to then isoflurane simply due to costs of sevoflurane. A second protocol is looking instead at the use of midazolam. Midazolam is a very good sedative. It causes also muscle relaxation. However, in rabbits, we do not have pharmacokinetic or pharmacodynamic studies, and the dose range is quite wide, between 0.5 but sometimes to 2 milligrams per kilo. There is a recent report in dogs that in 2 dogs, so not a huge amount of data, but 2 dogs with vestibular syndrome that showed neurological signs following administration of midazolam. We have no information about whether this is the same in rabbits. I've used midazolam for a very long period of time, and I've never seen any complication, or these specific complications at least. And then buprenorphine or methadone, again, as an analgesic, and then induction with ketamine, again, ET placement and maintenance with a gas anesthetic. On top of this, whenever needed, CRI can be used as well. As I mentioned, I don't routinely tend to use fentanyl, but many other colleagues do. The protocol may be slightly different. Fentanyl may be used as a loading dose and then a maintenance dose. I tend to use more often, depending on the procedure that I'm going to be performing, either lidocaine or ketamine as well. So what I would like to say with this is not my anesthetic protocol is not better than yours. I think what it is important to have is a consistent approach to your protocol. So if your protocol is working for you, there should be no need to change that. So no need to change what is already working. These are certain options that you may want to explore, but you need to have familiarity with the drugs. You need to expect when you're using certain drugs, and your nurses need to be aware of what to expect when you're using certain drugs as well. So it is important to be familiar with what you're using and try not to make changes simply because somebody else is using something different. And then endotracheal intubation. I think that endotracheal intubation should be the mainstay of any rabbit anesthetic, as it is for dogs and cats anesthetic as well. Why endotracheal intubation? Because it allows maintenance of patent airways, reduction of dead space, allows obviously delivery of oxygen and anesthetic gases, and allows mechanical ventilation whenever a mechanical ventilation is available, or manual ventilation obviously whenever this is required. Just on this point, there was not so recently a paper that showed that manual ventilation using a tight-fitting mask was sort of suitable in a resuscitation phase. However, this then led to a gastrointestinal complication. So obviously the air filled up the gastrointestinal tract and the stomach. So this should not occur with endotracheal intubation, but is certainly a possibility, an alternative when you're performing resuscitation. So why endotracheal intubation is challenging in this species? Because they are obligate nasal breathers. As you can see in the picture here, the epiglottis is normally in physiologic condition engaged on top of the soft palate, effectively separating the oral cavity from the respiratory tract. The larynx is recessed at the very back of the long and narrow oral cavity, so the access to the oral cavity is limited. Their gape of opening is quite narrow as opposed to that of dogs and cats. They have a large fleshy tongue in the middle of the mouth as well, and they have a small larynx and trachea. On top of this, laryngospasm is relatively easily induced in this species as well. So it's important to adopt specific correct technique and to be gentle as well, because the trachea in rabbits is quite delicate. Rabbits are used as animal models of tracheostenosis in humans, in children in particular, and it has been shown in several studies that simply lightly brushing the trachea can result in tracheostenosis. It's not something that I've seen commonly in in the last 15 years, but I've had a few cases of tracheostenosis following an inappropriate endotracheal intubation technique, simply where we've not been gentle in performing this procedure, or simply where rabbits were not anesthetized sufficiently and they were struggling during the intubation phase. So let's have a look at the different intubation techniques that can be adopted, that can be used. First of all, remember that hypoxia can be induced during the intubation, so pre-oxygenation should be performed in every rabbit undergoing or being intubated. Remember that an oxygen reservoir can be achieved in less than 1 minute of a high inspired oxygen concentration, but it may take a bit longer, even up to 5 minutes, when there is a respiratory compromise in the patient. As a general rule, considering the average size of the rabbits presented to a practice, a 2 to 3.5 millimeter ET tube can be used. Obviously, larger breeds may need even a 4.5 millimeter, but this is not routine in the majority of the breeds that we see in practice. And I tend to use uncuffed clear ET tubes because they allow me to see the condensation within the tube, and obviously the lack of the cuff. We don't need the cuff to inflate the trachea because the trachea is very delicate. So if you're using a cuffed tube, remember that this will massively reduce the possibility of passing a tube down the trachea. The cuff should not be inflated. Always remember to pre-measure the tube as well, approximately 1 centimeter past the larynx, because I've seen cases of tracheostenosis where the bronchi were even intubated, especially when very long tubes are inserted very far down into the trachea. We already mentioned the use of tight mask for ventilation. It is not something that, as I said, I tend to use routinely, but on an occasion when repeated intubation attempts have been made by myself and a colleague, and the intubation is being unsuccessful, but as I said, is a very limited number of cases, especially when you become more experienced with the intubation itself, then a tight mask can be used to maintain the patient during a general anesthetic. But as I said, is not my preferred way of maintaining a rabbit. Blind intubation is possible. You can see that in the picture. The colleague is, there are two options. You can have either a handler holding the rabbit for you, or you can hold the rabbit while listening to the respiratory sounds. It is not my preferred method. However, there are some exotic colleagues that have been using this technique for over 20 years without any problems. My main concern is the fact that without visualizing the glottis and the oral cavity, you have no idea of the food material that may be present right in front of the glottis. I had one case where I had to remove the hay from the trachea with an endoscope because with blind intubation I had been pushed down the trachea itself. My two preferred methods for intubation in rabbits are the orotracheal intubation with an otoscope cone and an introducer, and you can see that in the picture on the right-hand side. So in this case, a long cone and an otoscope are used to visualize the glottis. So you can see the nurse on the right-hand side is holding the rabbit, but is then the person that is performing the intubation that is pushing the rabbit to the right position to visualize the glottis and look at the overextended neck, which can become a problem, especially in rabbits with a compromised respiration. So always be ready to provide oxygen and to replace the rabbit in normal position should the breathing be compromised. The introducer is simply a urinary catheter, the smallest dog urinary catheter that you can find. what you do with you insert the urinary catheter through the otoscope cone directly into the glottis and the trachea, and then the ET tube of an appropriate size, you can slide a 2 millimeter through the urinary catheter, is then slide over the tube directly, the urinary catheter directly into the trachea. Currently, because I have an endoscope available specifically for rabbit intubation, this is my currently preferred method. In this case, either you have a 1.9 millimeter or 2.7 millimeter rigid scope. And the techniques for direct visualization in this case are the over the endoscope, where the ET tube is fed on top, slide over the endoscope so that the trachea is directly visualized and the tube directly inserted into the trachea, or side by side, slightly more difficult because you have to handle the scope, look through the scope while feeding the tube to the side of the scope, down the mouth and into the trachea, so a bit more fiddly, but this would be the same technique that we would use, for example, in rodent species such as guinea pigs or chinchillas, for example. A laryngoscope may be used as well. I've used that very rarely, but in the past. Nowadays, either with the otoscope or with the endoscope intubation, I find it is much easier. And then I'm not sure you are aware of the availability on the market of the VGL, so supraglottis airway device that is supposed to seal the trachea and allow sort of intubation of the rabbit. My main concern with the use of the VGL is that it tends to move relatively easily during a procedure, and therefore it should be used alongside a capnograph to make sure that the VGL, the device, is not displacing during the procedure. Otherwise, you risk to ventilate the stomach and inflate the stomach. Another thing is that sometimes can cause compression of the tongue, so the tongue becomes quite dark gray, but this is easily solved simply by replacing the VGL. However, I must say that in an emergency situation, or when you are unfamiliar with intubation technique in rabbits, is certainly an option as opposed to mask ventilation, because is relatively easily placed. In one study, it took an inexperienced inexperienced vet to intubate about 7 seconds. So it's something that's certainly to consider in private practice. However, they are relatively expensive. So whenever possible, personally, I would prefer to practice the other intubation options. And this is the VGL. There are different sizes, depending obviously on the different sizes of the patient you have. Alternative options, I must admit I don't tend to use these, but just for completeness, these are out there. Nasal intubation, nasotracheal intubation. However, remember that these guys have a very, very sensitive nasal mucosa. So nasotracheal intubation can lead to complications. So it's something that I don't tend to use routinely. I know of colleagues that do use them, for example, for dental procedures. And then temporary tracheostomy, again, this is not done as routine. I perform probably 1 or 2 as an emergency when access to the face for extensive facial surgery was required and endotracheal intubation was not possible, for example, for the presence of a mass or other complications. But it's something that is technically possible. The technique is similar to that of dogs, but is not something that is obviously routinely done. So in 1986, the American Society for Anesthesiologists stated that circulation, oxygenation, ventilation, and temperature should be monitored continually throughout an anesthetic procedure. And I should say this should be the same for a rabbit anesthetic as well. Monitoring a patient continually at set and frequent intervals is essential to allow, a positive outcome of the procedure. The rabbit's heart cannot be checked every 5 minutes because in those 5 minutes loads can happen, and usually when something happens, the complication occurs faster and there is no time for efficient intervention. So best to prevent rather than cure, I would say, in these cases. So monitor, what can we monitor throughout a procedure? Now, reflexes, I would say reflexes are still considered a reliable way of monitoring the depth of an anesthetic and the reaction to painful stimuli. So there are some that, depending on the species, but specifically rabbits, are more reliable than others. For example, the ear pinch or the pedal withdrawal reflex, but some others are not to be considered as reliable. For example, the corneal and palpebral reflexes may be partially present throughout a general anesthetic, although their loss may be an indication of excessively deep plane of anesthesia. These other reflexes are not generally monitored, especially for what concerns rabbits, may not be particularly reliable in this species. Positioning is another thing that we need to monitor throughout an anesthetic procedure in rabbits, and we've already mentioned the anti-Trendelenburg position with the chest slightly elevated compared to the abdomen. And the sternorecumbency, obviously, when rabbits are kept in sternorecumbency, always remember that this can impair breathing, especially when an underlying respiratory problem is present as well. So positioning has to be checked regularly as part of the anesthetic monitoring as well. Which are the vital parameters that are or can be routinely and regularly checked throughout an anesthetic procedure? Respiratory rate, easily done. We can monitor the movement of the chest or the reservoir bag, especially if the patient is intubated. Now, remember that rabbits can have a very rapid respiratory rate. This may not necessarily mean that the patient is light, and this is the same for rodents, for example. Obviously, if we are using a mechanical ventilator, then the respiratory rate is set by yourself and by the machine. The heart rate, and obviously we'll discuss later how to monitor all these parameters, the temperature, the blood pressure, the end-tidal carbon dioxide, and the arterial hemoglobin oxygen concentration. So let's get into the monitoring phase. The cardiovascular system can be effectively monitored by checking a regular interval, the heart rate and the rhythm, and we'll see how this can be done by checking perfusion, and there is nothing high-tech here. It's exactly the same as checking perfusion in a dog or a cat, checking the blood pressure, and there are different methods that can be used, but generally in rabbits, the indirect blood pressure with the Doppler method is the one more frequently performed in practice because more easily accessible. The direct blood pressure measurement is very difficult in practice, and then oxygenation can be simply monitored by using a pulse oximeter. More specifically, let's have a look at the different sections. So heart rate and function. A stethoscope simply can be used to monitor the heart rate. An esophageal endoscope can be used as well, or a Doppler probe. I particularly like the Doppler that can be placed over an artery. You can see in the picture on the left-hand side of the screen. The Doppler in this case is also used to monitor the blood pressure. The Doppler is placed over an artery or simply over the heart, and this allows a constant monitoring of the heart rate of the patient, allows awareness of the entire room. So it means that everyone in the room is aware that the heart is beating. Everyone can identify drops or changes in trends of the heart rate during the procedure as well. And it also doesn't pick up alternative electrical activity, for example, when using an ECG. If an ECG is available, obviously should be used as well. So any monitoring equipment that you may have may be particularly useful, but remember, for example, some multi-parameters monitor may not be adapted to pick up very high respiratory rates or heart rates like the ones that rabbits have. So may not be suitable, that's what I was meaning. Perfusion, as I already mentioned, is very easily done, checking the color of the mucous membranes, the capillary refill time, and remember that it's not just the oral mucosa, but the rectal mucosa, the vaginal mucosa, the conjunctival mucous membranes can be used as well. Evaluating the femoral pulse quality, the heart rate, we've already saw that, blood pressure and pulse oximetry. This allows to titrate our fluid therapy as required to the patient's needs. And then obviously blood pressure monitoring. We've already mentioned, during the talk, that many of these techniques are simply extrapolated from what we do in dogs and cats. There is no difference in checking the blood pressure in a dog or a cat or in a rabbit. We're using exactly the same equipment. The only difference may be the cuff size. Generally, a cuff 0 or 1 should be used to avoid underestimation of the blood pressure. The cuff size should be approximately 40% of the circumference of the tarsus, carpus, or humerus, depending on the area where the cuff is placed. And generally, the radial artery in the front leg or the digital branch of the tibial artery, if the rear leg is used, are generally used for evaluation of the blood pressure. Generally, in healthy rabbits, the systolic blood pressure is between 90 and 120 millimeters of mercury. Remember that during a general anesthetic, most rabbits are hypotensive, so fluid therapy should be used to maintain the blood pressure in these patients and to help titrate the fluid therapy as well. Pulse oximetry is certainly a non-invasive and economic method of monitoring blood oxygenation in rabbits. It can give an indication of hypoxemia. However, it does require a good connection with a peripheral blood vessel, which may be a problem, for example, in pigmented rabbits. Probes are generally designed for the tongue. This is much easier than on the ear vessels because of pigmentation and because of the better contact with that anatomical part. However, remember that pulse oximetry can be unreliable because arterial oxygen concentration often fall significantly before any changes are picked up in the SpO2 levels, so in the reading reported by the pulse oximeter. Also, further to this, there is no information provided by the pulse oximeter on blood flow or tissue oxygenation of the patient. So it's something that it can certainly be used, something that you may not want to rely completely on, and it does not give you any information about the cause of the problem as well. So this is the pulse ox that we use in our practice. Finally, ventilation. So the capnograph. I think the capnograph is one of the best friends of the exotic vet. It is a relatively economic way of monitoring the respiratory function. The capnograph displays on expiration the maximum concentration of carbon dioxide found throughout the expiratory phase, so what is called end-tidal carbon dioxide. And the end-tidal carbon dioxide reliably correlates with the arterial carbon dioxide concentration, so the capnograph can be relied upon differently from the pulse oximeter. Further to this, the capnograph also displays the concentration of carbon dioxide measured against time. So the capnograph gives you also a graph. So it can give you evidence of inadequate ventilation as well as its cause by evaluating the capnogram trace. The capnogram in particular consists of 4 phases, and again, this is no different compared to what you see in a dog or a cat. The third phase is the most important because it indicates how the lungs are performing at that time and gives you information about both perfusion and ventilation of the patient. So definitely once you know why there is a problem, you can act on it quite efficiently and in a timely manner as well. Temperature monitoring. This is something that I really want to stress out in rabbits. Rabbits have, like all small mammals, a high body surface area to volume ratio, so they are prone to rapid heat loss. And because the thermoregulation is further depressed during a general anesthetic, this is something that you really need to act preemptively rather than, once the problem is occurred. Also remember that cold and dry gases, shaving, the use of alcohol, cold skin disinfectants, the exposure of viscera or using of cold saline during a surgery can further cause heat loss. So hypothermia is one of the most common complications during a general anesthetic and a surgical procedure that we see in rabbits and other small mammals. Hypothermia is a significant negative factor during an anesthetic procedure because it can prolong recovery, increases the potency of volatile anesthetics, depresses cardiovascular function, causes coagulation disturbances, and ultimately results in in increased percentage of anesthetic deaths. So it's definitely something that we should act upon preemptively. Now, I haven't mentioned this, but the majority of heat in these guys is lost by radiation. So the best thing that you can do is to try and minimize the difference in temperature between the environment. And that's the reason why my surgical theater is always in like exotic tropical temperatures. So we increase the environmental temperature and we insulate the patient to try and minimize the gradient in temperature between the two of them to result in less heat loss by radiation. So how can you do that? Now, often exotic vets are the one that use their imagination. They use what they've got available and try and make it into something that can be useful for them. Obviously, whenever possible, circulating warm water blankets, bear huggers, hot dogs, all this sort of, more fancy equipment can be used. But whenever this is not possible, don't think that the fancy stuff is necessary. It's obviously very useful if you have them, but warm water gloves work okay, heating pads, always make sure that obviously the patient is not directly in contact with a hot surface to prevent burning, because I've seen many of these complications quite a few times. And then in the post-operative period, obviously heat lamps, incubators, if obviously the equipment is available, you can wrap the animal in cotton wool, aluminum foil, bubble wrap. What we tend to do sometimes is to bubble wrap around all the extremities, including the tail, to insulate the patient. Often when we are doing surgery, we also use clear plastic drapes because they tend to maintain the heat as well as allowing easier monitoring of the patient as well. And obviously remember that the fluids that you are providing throughout the procedure should be warmed at least to room temperature. You can run an IV line through hot water if the IV warmers are not available. And you can warm the oxygen as well. And as I mentioned, you can simply heat the room where the patient is placed. I mentioned already that one of the frequent complications identified during the first of the studies that I mentioned at the beginning of the procedure was hypothermia as well. Why this happens? Usually happens not just throughout the procedure, but in the post-operative period where the animal is simply placed back into the cage where it was at the beginning of the procedure and left there without any further control. The rabbit is not awake yet, the temperature, the thermoregulation is not back into control, and the rabbit keeps losing heat. And as we already mentioned, hypothermia can prolong recovery, resulting in complications. Further consideration, one important thing that you need to consider in rabbits anesthetics of any duration and importance is having a constant awareness of the patient status. We do have dedicated rabbit anesthetic sheets, and the anesthetist, whether a nurse or an anesthetist, fills up constantly the sheet throughout the procedure at set intervals, which are very close to each other. So what it is important is not to know what's the heart rate now and in 10 minutes. It's important to know during this period what the rabbit has been doing, the heart rate or the respiratory rate has been doing. Always remember to protect the cornea, because ocular desiccation and ulceration is extremely common in rabbits and other small mammals, because we're using dry gases around their face because their eyelids remain open. So it's something that we do see extremely commonly. It was more of a problem when we used a certain type of ocular lubricant. More recently, we've changed products under advice of an ophthalmologist. We tend to use Celluvisc now, and since we've been using this and lubricating the cornea more frequently, we've not seen any further of these problems. And always remember, fluid therapy should be given throughout the procedure as well as during the postoperative period as well. We tend to use 10 mL per kilo per hour, given either as warm boluses every 15 minutes or as a constant rate infusion, as we've already mentioned earlier on. And finally, recovery. The general anesthetic is not ended yet. Remember to record observations at regular intervals in the recovery phase as well. And this includes checking body temperature, heart rate, respiratory rate, blood pressure is possible if available at set intervals in the recovery phase as well. Remember to check the body position, because this should not compromise breathing until the animal is not able to freely move in the recovery area. Provide stimulation at least at the very beginning of the recovery phase. This should not be encouraged once the animal has regained the ability to stand and move around to reduce stress. Ventilation, so either mechanical or manual ventilation, oxygen provision should be continued, as well as fluid therapy depending on the patient's needs, especially where long recoveries are occurring. Keep intubation equipment nearby, may this be needed in case of an emergency, and provide oxygen as required. So what's the aim in the recovery phase? We need to make sure that we continue monitoring the patient until it can regulate and control its own body temperature. So until the temperature stops dropping if the heat provision is not continued, until the patient is showing increasingly more voluntary movements, until the biological parameters that we've checked at the beginning of the procedure by performing the physical examination on your patient, not checking the average parameters on a textbook, have returned to baseline levels. Only at this point we can say potentially that the patient has recovered. Now, where to recover the patient? Initially, an incubator, a warm enclosure, so do not leave the patient in the cold, because hypothermia is always a risk. Sustained voluntary movement indicates usually that the patient is able to regulate his own temperature at that point, but continued support may be needed still at this point, like oxygen, ocular desiccation, fluid therapy, heat stimulation, obviously if required, check for hypoglycemia, prokinetics if required. So all these are considerations for the recovery phase. And then the environment. Why is this environment so important? Because we've already said that rabbits are prey species. Rabbits are particularly prone to stress, are particularly subject to the negative impact of catecholamine release, and therefore a stress-free environment should be offered throughout the hospital stay, but in particular during the recovery phase as well. Food and water should be provided as soon as the rabbit is recovering from the procedure. A companion whenever possible, and do not judge in this case. You can see here a trio that was presented to the hospital. One only of these rabbits was undergoing a procedure, but the other two were present because it is not recommended to disrupt the bond a rabbit may have with 1, 2, or 3 or more companions, but room should be available for all of them to be presented to the hospital, because the presence of a companion can reduce the stress of the patient and can fasten the recovery as well. Some rabbits come with a different type of companion. This rabbit had a seal companion, so a stuffed toy, but it was particularly bonded to the toy, and therefore every time he came into the practice, he always used to come in with the toy. So do not judge. Everything is allowed as far as the stress for that patient is reduced, because this can impact positively on the outcome of the procedure. And then always provide a hide, so do not leave a prey species recovering from a general anesthetic exposed to predators, which may mean a dog, a cat, a ferret, a bird of prey, but simply a human as well. So always provide the patient the option to hide away, to move away if fear or stress is felt, or whenever the rabbit feels like seeking, hiding in a different place. Nutritional support is essential in small mammals, especially in rabbits, due to a high metabolic rate. Reportedly, anorexia can lead to hepatic lipidosis in a very short period of time. So within 24-48 hours of anorexia, a secondary liver hepatic complication can occur in this species. So it's something that needs to be taken into consideration whenever possible. Caloric support should be provided immediately following recovery from a general anesthetic. How can this be achieved? By using syringe feeding. This is the preferred method. Some rabbits may be more or less amenable to syringe feeding, but it's something that should be attempted at all times. Nasogastric tubes can be placed relatively easily but obviously certain types of formula should be used to feed the rabbit through a nasogastric tube, and that tube should not be left in place for a very long period of time because it can result in secondary rhinitis or secondary complication, but certainly an option, for example, for extensive facial surgeries. But whenever possible, this should be avoided to encourage the rabbit to chew, to wear the teeth down as well, and to start, allowing the gastrointestinal tract to work and function as normal as well. This is another important aspect of any rabbit's procedure, any rabbit's general anesthetic, and it would be worth a completely different and a separate lecture itself, but just very, very briefly, I would like to mention some main points. We've already said several times, rabbits are prey species. They are masters at disguising signs of disease, pain, and stress, and therefore are less likely to receive analgesia compared to other species as well, like dogs and cats. And this is often due to the fact that we are not able readily to identify pain in these species compared to other species like dogs and cats. In one study, UK-based, it was published quite a while ago, but significantly 50 to 70% of dogs and cats for the same procedure were more likely to receive analgesia as opposed to rabbits and rodents that for similar procedure only received analgesia in 21% of cases. So obviously pain is under-recognized because in the majority of cases, veterinarians are not familiar with the normal behavior of this species, and sometimes because food and water intake may not be reliable or a reliable estimate of the type and the amount of pain a rabbit may be in. So certain pain scales come useful to allow veterinarian a better way of identifying pain and therefore treating pain if we are more able to and readily able to identify pain. We are more readily able to treat it as well. One of these is the Rabbit's Grimace Scale, and the second one, which is been recently published, is the Bristol Rabbit Pain Scale. If you go on the Bristol University, you'll find the pain scale there. And this has actually now become part of our hospitalization monitoring as well, because we do have the scale as part of the hospital sheets, and our nurses can score the rabbit pre and post analgesia to see if any rescue analgesia is required, if the pain level are being sufficiently treated in that specific patient for that specific procedure. Always remember the concept of balanced and preemptive analgesia, which are no different to what you know from the dog and cat world, because these can be and should be applied to rabbit medicine and to rabbit anesthetics as well. And finally, very briefly, I just wanted to mention anesthetic emergencies. Unfortunately, they are quite common, but it's important to be prepared for these anesthetic emergencies in advance. So, as a general rule, respond if the heart rate is slowing, irregular, or the patient is becoming apneic. If for any apnea longer than 10 seconds, then immediate action should be taken. Intubation equipment, if the rabbit is not already intubated, should be readily available for any anesthetic procedure, as well as an ambu bag or a mechanical ventilator whenever possible. Reversal drugs are important. I will never stop to stress out that reversal drugs should be worked out at the beginning when the checklists are done, and not when an emergency occurs, because it will be too late. There is no way you can manage to work out sometimes volumes in the region of 0.0. If you are in an emergency situation, you need to have the volume already worked out for that specific patient, and have the drugs ready for use, for example, with the vial and a syringe next to it in case an emergency occurs. Crash charts are very useful. There are many online, or you can create your own. In this case, the different emergency drugs for different species, because this can be used not just in rabbits, it can be used in rodents, in birds, or in reptiles as well. Different drugs are already worked out in terms of volume for the weight of the species that you are taking into consideration. This reduces drastically the time needed to work these drugs during an emergency. Now, this is no different to what you would do in a dog or a cat, but I wanted to stress out with this slide simply the fact that between respiratory arrest and a cardiac arrest, you may not have the time to do all these things. So always be prepared, for example, for the fact that if a respiratory arrest occurs, you're very likely to incur into a cardiac arrest soon after it. So be ready, start ventilating, stop the anesthetic gas provision, establish airways if these have not been established at the beginning, and immediately start chest compressions whenever this is needed. And always monitor as many parameters as you can to try and overcome the difficulties that you are encountering. So when finally anesthesia ends in a rabbit, when the patient has shown sustained voluntary movements and is able to stand, when he's demonstrated temperature regulation, so when he's able to regulate his own temperature without you needing to provide that heat, when those baseline biological parameters that we determined on our patient during the initial physical examination prior to the anesthetic have returned to baseline, so to the time zero that we've already discussed at the beginning of the lecture. So why this is important? Because in that study that I've mentioned at the beginning, it was shown that the majority of deaths related to a general anesthetic actually occur in rabbits within 3 hours following the general anesthetic. So it's not just the procedure itself. The problem is the recovery phase, is when we are not attending to the needs of that patient in that very delicate moment that can result in complications and therefore in deaths as well. So what's the take-home message? Be prepared and plan, I would say, is my first advice. Secondly, certainly use the knowledge that you already have, the skills that you already have established, because you do dogs and cats every single day, but these can be adapted to the species-specific requirements of rabbits, having in mind the different anatomy and physiology of the species, the different behavior, and the different needs of these species as well. And then whenever possible, invest in equipment that can certainly improve the success, the efficiency, and the safety of pet rabbits anesthesia. But most of all, have a consistent approach. Once you find your approach that works, stick with it and don't change it. So I hope you found this talk useful. I hope you get some information, some useful tips out of it, and I'm happy to take any questions at this point.
Elisabetta, thank you so much. It's amazing talk about this topic, which is not easy at all. Have you got rabbits on your own? Have you got rabbits at home?
I would say I don't, because I've had a Jack Russell for like 12 years. So until he's around, I'm afraid there will be no rabbits here.
Not a good idea, yeah.
No, he was a present at a time during which I couldn't have rabbits, and obviously now he's my baby. And but I would love to have rabbits at some point, but rabbits needs to be kept in a certain way. And I don't want to have a rabbit like at the bottom of the garden and forget about it. It needs to be done properly. So until I can't provide that environment, then there is no way I'm going to do it.
I had a rabbit once, and actually it was very, very, very nice. And
They are entertaining. They are very, very interesting to watch.
Yeah, it used to be free in the house, and I had other pets. I had cats, and he was really, I would say, bossy with them. So he knew how to be respected by them, and
Yeah.
But yes, I agree with obviously you know better about the level of stress, because one day I think it happened that one of the cats had like it was not a real fight, so it was just, you know, the cat was how you say running behind him, and then he had like a scratch in the ear.
Yeah.
And then from that point he went downhill, so I lost it. So he started not to eat. I don't know what happened exactly. So obviously we have seen a vet that should have known what was going on, but we unfortunately lost him. It was really sad. Yeah. Anyway, Paolo knows something about that. Anyway. So I'm just talking because I would like to see questions here for our speaker. So in the meantime, let me remind you why we are all here. We are here because we want to raise funds for Ukraine and to help people. So don't forget to click on the link if you haven't done it yet. And don't forget to share our webinars with other people. And we forgot at the very beginning to share a disclosure slide, which is, maybe Paolo, can you show this, just to show that all the informations and animals in the photos are photos that belongs to owners that have given consent to be used for teaching purposes only, and you cannot take, please, you cannot do screenshots and use these photos for other purposes. There were no photos about surgery, so no worry about that. But basically, these are all information that we use. We are allowed to use them for teaching purposes. So I just wanted to reiterate this. Paolo, any questions for Elisabetta? So Georgia is an anesthetist. So can you read the question on the screen?
Yes, so thank you very much, Elisabetta, for this great talk. Thank you, Georgia. I wanted to ask whether you give a bolus before any of the mentions here arise. The loading dose, as opposed to just starting with the maintenance dose. I've tried both, to be honest. Sometimes I do, sometimes I don't. I guess anesthetists may prove me wrong, but it depends on the anesthetic protocol I'm using and whether I'm using it in the pre-medication phase or not. So not always is the answer.
Thank you. Let's see, have we got any other questions? Maybe, I don't know, maybe David, you got questions already?
Yes, I have. Perhaps this one from Lisa is a better one of the one I was going to ask.
So do HMEs cause too much resistance to breeding to aid temperature regulation?
HMEs?
Yeah. You know, these connectors that they are used in dogs and cats.
To be honest, I don't know them in particular, but I tend to use as least equipment, like to try and reduce the dead space as possible, and resistant to breeding to a temperature regulation. I don't really know that, to be honest.
Maybe Lisa, can you just specify better, because I'm not an anesthetist and I also struggle to. I know that we use HMEs in cats and dogs to in anesthesia, but maybe if there is some anesthesia connected with us, could you please join us and comment on that? So what is the HME exactly used for in the anesthesia? Exactly.
It's a moisture exchanger. I don't think I've ever used it, to be honest with you, so I wouldn't be able to answer to that.
Lisa, so what is the advantage of using HME in cats and dogs? So we heat and moisturize the gases that are that we give to inhalate during general anesthesia, I guess, right? Let's see if she.
I should probably try and use it. Yeah. They warm inhaled gases and conserve moisture with bacterial filters. I should probably ask the dog and cat vets if I can have one.
Yeah, you can find it easily. So, for example, I just think about so the bacterial filter is also maybe I'm saying something stupid, but we use. When we have dogs with kennel cough, for example,
okay.
we do isolate them. It is important that they come out when they are anesthetized in their kennel. They have the AHME on whilst they are taken from the kennel to the operating room anesthesia, just to avoid spread of the aerosol of the
That's a very interesting question. I'll definitely look into it.
Oh, Alan! Hello, Alan. Do you know Alan Taylor? Alan is an anesthetist from the RVC.
Oh, perfect.
Who moved? Who moved from London to Hong Kong? And it was when I moved. There's another story. So when I moved to Hong Kong, because I work in Hong Kong as well. So Alan was the first specialist anesthetist in Hong Kong, and we have worked together at the very beginning. So you see, HME, heat moisture exchanger, can also
I'll definitely look into it. I'll probably add another slide in my next talk.
So can get very wet and increase resistance to breathing, so may need to be changed regularly. So basically, the answer to the question is no, you don't use it.
No, I don't use it yet. I'll have to look whether this is something feasible in rabbits and whether it can help or not, because I to be honest, I don't know.
It would be interesting to have some. I don't know if there is someone that is brave enough that does, because the anesthetist. I know that the anesthetists or those that do the residency in anesthesia, they have to do exotics as well, and sometimes they are really agreed to anesthetize these patients, but most of the time they have. So the caseload is based on cats and dogs. So it would be interesting if one of these persons on the other side of the camera are brave enough to join us in this discussion, because obviously I'm a surgeon, and obviously I have the limitations of not knowing much of anesthesia. But if someone is happy to join us right now, just send us a message, and then we will try in real time to get you in the live. Yes.
Another question: do you have experience with the dobutamine CRI in critical rabbit patients? To be honest, no. It's not one of the drugs that I've used, the CRI, so far. I'm not sure of the dose either, but if you check out that paper that I mentioned during the talk, you may find a bit more information there, or check for the available literature, but not personally, I'm afraid.
I see Paolo is sending me texts. Maybe let me see.
Elisabetta, can I just say congratulations for the excellent talk? Very interesting.
Thank you.
I used to do soft tissue surgery for many years, and I remember, each time we had a patient that was a rabbit, the young people within the practice would disappear. Nobody wanted to be involved with the death of a pet until we got a few specialists in. And I do believe that one of the main important things about rabbit is that the vet has to be competent that particular species, that they're not cats and dogs. I think that's the most important thing, that sometimes we forget. Treat the animals all the same, but those animals are very delicate, as you said. So
yeah,
very
definitely.
interesting. Thank you very much. And thank you,
Thank you,
Petra.
Thank you,
Thank
Petra.
you, Petra.
Hi, Petra. I hope you are doing well.
I think it's good that, I mean, when I graduated, I really did know exotic medicine at all, but nowadays, exotics are included in the curricula of many of the universities, at least here in UK, and I think in Italy as well now. So, it's not the same as in dogs and cats, but there is definitely more information about these species as opposed to what it was in the past. So it's then up to the vets in practice to become more familiar with the species, to get information, but there is something that is offered by the university compared to the past. So it's definitely, we're definitely going in the right direction.
Yeah, I find that exotic pets vets are particularly enthusiastic about this species. I've got a couple of friends in Italy that you will know, Paolo Selleri and Giordano Nardini. And they're really good fun. I mean, I did a course in exotic pets for 3 days in Cremona, and they were, the teachers, and they were amazing on how interesting they made it and how knowledgeable they are. Particularly endoscopy with Paolo and reptiles.
I started with Paolo, so I know him well.
Good.
Elisabetta, you don't do raptors, yeah? You just do small mammals.
No, we do everything.
You do raptors.
Yeah, so my colleague is a European diplomat in avian medicine, and we do see all exotics. So we are both certificate holders as well. So we see everything that is different from a dog or a cat, let's say, pet-wise, the occasional zoo animal, but mainly, like, the caseload is mainly rabbits and small mammals. Then, because obviously of my colleague, birds, probably equally just under reptiles, and then everything else. So birds of prey, where I am, not as commonly as in other places where I've worked, but definitely we do see them, we do them.
We have a comment here that there is someone, but it would be great to know the name, Paolo. So that would be happy to participate. Are we talking about participating now, or so?
I think he's a resident.
Is Elisa Silvia? Ah, yes, Elisa Silvia. Yes, ciao, Elisa. She's a resident, and she's right now she's doing her period at the WA referrals. Yes, I'm happy if Elisa is happy to join us in the live, Paolo. Let's organize it. Yeah. We have done a patient today. It was not a rabbit, obviously. It was yes, we are trying to organize Elisa. Let's see if she manages to.
It would be interesting to see if there is any literature at all on their use in lab rabbits, for example.
About the HME or about yeah. I don't know if there are other questions, Paolo, in the meantime. Do you do many rabbits with dental abscesses, or is something that belongs to a different discipline, like
oh no, that's my everyday bread.
Yeah.
Yeah, that's the part I love the most.
You like it? Okay.
Oh, yeah, loads of rabbit dentals and complicated dentals, so abscesses, stuff like that. That's very common. Not as common as in the past, I guess, because husbandry has improved.
Yeah.
We tend to pick these problems at an earlier stage, let's say, but definitely, a lot of them.
So I have a message for for Elisa. Elisa, apparently Paolo has sent you the link You just need to click the link, and then you will be live. You don't need to make you up, or you don't need to go to
It doesn't matter if you're in pajama.
Look at us. We are. So just come on, Lisa. We are waiting for you. No, you know why? Because I was thinking about when I was in Munich during my residency. There was a person that used to do the exotics, and I saw many of these huge, horrible abscesses, and she used to leave really open cavities in the jaw. So it's still the case. So there was really like
there are different techniques, but the marsupialization is the one that I prefer as well. So we try whenever possible to remove the entire abscess as if it was a mass. But where that is not possible, which is often the case, then you leave it open. So marsupialize. So usually they have these huge holes on the side of the face, which you then treat as a wound, as an open wound. We allow closure for secondary intention, let's say. But this is what I found in my experience that leads to the better outcome as opposed to other techniques.
Yeah, but for example, again, forgive me if the question is really silly. So, but with the open cavities and them living in so it's a bit difficult to keep them clean. Okay, so they get dirty in the when they are at home with the owners. So
the owners are taught how to manage the wound at home, so how to flush, how to clean, debride, and apply, like a healing promoting cream or something like that.
Okay. So Alan, sorry, I know you might. What time is in Hong Kong now? So I guess it's 10 now. 10 here. It should be 10 minus 8. It should be 2 in the afternoon. Alan, are you available to join us? So I see that you're very active, and you sent a link to a paper on HME versus heat dehumidifier during IPPV. If you want to join us, Alan, you know that you're very welcome. So it's an occasion to see you again. So what are the most frequent surgeries? So that you do dentals?
I mean, we do first opinion as well as referral work. So it can be anything from a spay, a neuter, castration, to I don't know, any abdominal surgery on the gastrointestinal tract, on the urinary tract, liver lobe torsions, cystotomies.
It would be good a talk. Sorry, I'm suggesting a talk on how to recognize like that if a rabbit is having a colic or something like that, because I remember I had a problem when I used to do locums in the past with colic in a rabbit. So it would be, I don't know, it would be a nice topic.
This is like a big like not really a colic, but like the difference between gastrointestinal stasis and obstruction, for example. This is the big challenge in practice, let's say, when you're dealing with a rabbit that has not been eating.
Yeah, absolutely. So Paolo is organizing with Elisa, and I think there is a problem with Google Chrome. So let's see if we manage to have that. Alan, are you in the meantime? Are you willing to join us? Alan, please. Alan, by the way, was at the beginning was horses anesthetist. So when he moved to Hong Kong, he had to deal with, in Hong Kong there are many toy dogs, so he had to.
That's a big change.
Yeah, exactly. Get used from huge animals to toy dogs. So Paolo says that he's talking to many colleagues and we need to take time. Okay, let's talk about. So we are really doing a long live. I think Elisabetta, you are winning the prize for being the
always rabbits.
Alan is 5:15 in the morning. Oh my God, sorry, I was completely wrong. 5:15 in the morning. I don't know if Alan is no, he cannot, and he's very thankful, but he cannot. I understand, because at 5:15 in the morning,
Yeah,
he might be still in pajama, and then he has to
he
keep
may be pushing it a bit.
exactly blessing. Yeah, exactly. He needs to prepare the kids for school and everything. Yes. What I wanted to ask about no, I don't have questions in particular. I don't know if David has something whilst we are waiting for.
I think, I don't have any specific rabbit question.
No.
What I can say from my point of view is that when I qualified and I went to the UK to sort of gain experience, which was in 92,
Long time
93,
ago.
for 5 years. Yes. I was a little boy. I remember in England at the time it was me and another Italian. I'm happy to see that, throughout the years, the Italians appreciated going to the UK, because before they all went to the States. But now there's a lot of people, and it's nice for me that I've joined Vet Partners, 3 years ago. Then now I meet you, Elisabetta, in the same company, in different countries, but you come from common, grounds. So I think that's very nice, and I think what Daniela is doing, bringing all these people together, and it just happened yesterday. We had a conversation. It was like we are all friends, because once you share this kind of meaning and this kind of purpose in life, then it just makes everybody, family. So it's nice to see you. And if I have to compare myself with you, when I went to England, I was, absolutely unprepared for working in a mixed practice in the UK. So I was dealing with rabbits and hamsters and stuff, and then cows and sheep and horses. It was frightening, the amount of challenges you had. And now you see younger people that go there, but people like you, they're very talented, and you got so much knowledge, and your English is perfect.
Thank you.
And you can see how better the generations are in a way. And that's very nice to see.
Thank you.
And Paolo says, and she doesn't even have the Roman accent. So
No, yeah. Not when I speak English. Apparently, I sound from Milan when I speak English.
This is me with the accents from Milan. Elisa is coming, so it's nearly there. But yes, I completely agree with what you were saying, David. So thinking about the past, also now I have a certain age. I'm not so young anymore. And when I was a younger vet, and at the time, so if I think about my vet school pulse, I was one of the fewest that moved abroad. So, and immediately after the vet school, I moved to Munich for the internship and residency. And I think we have had one of our speakers, Simona Radaelli, who is a specialist in neurologist. She was in my year at the vet school, and she also moved to the UK. So she did her residency in Germany, actually, and then she moved also to the UK. So basically, of my year, I think there are 2 of us that have done this, and now there are more and more young people that are deciding to move abroad and to.
Yes, and some of them are extremely successful, like yourself. I mean, the name of Daniela or Elisabetta or other people, and here's Elisa. Hello, Elisa.
Hello, hi.
Thank you. How are you?
You waiting, and sorry for my bad face, let's say.
No worries. So it's not. So we have to talk about rabbits, not about like
passion.
Yeah,
exactly.
So you wanted to comment about the HME in rabbits, or do you use the HME in rabbits?
Well, we actually don't use it because, as Elisabetta say, and by the way, it's a pleasure to meet you, Elisabetta. I
Nice to
really,
meet you
really
too.
enjoyed your talk. And yeah, for the matter of the dead space, because sometimes with such a low volume capacity and such a low tidal volume in these animals, even a very tiny dead space can make the difference. Especially if they are breathing spontaneously, so we are not ventilating them, actively ventilating them. So yeah, we tend not to use them, but it's something that maybe it's worth to try and dig into, because maybe, you know, as they did the VGel specifically made for rabbits, which were not present like 10-15 years ago on the market, and we were trying to adapt the one from cats, which actually had several bad consequences on rabbits. Maybe if we start to use them and dig into them, maybe, I don't know, in 5-10 years there will be HMEs specifically thought for our rabbit patients. So that's one point that we can try and dig into for sure.
Thank you, Elisa. By the way, because you join us in the live, but we haven't introduced you, so for everyone. So Elisa, so maybe you can introduce yourself, so you know better who you are than me. You want to introduce?
So I am Elisa. I am currently a resident in veterinary anesthesia. I'm doing a non-conforming residency, so part of my residency is in Italy and part of it is mainly in England, let's say. And in Italy, I work in Rome at the CVS, which is Centro Veterinario Specialistico. So it's a hospital which is very, very, very oriented to exotic animals. And yes, so Paolo Selleri is actually the sanitary director. And so I was very lucky because he asked me to start anesthesia department there. So we started this adventure a year ago, and I have to deal with lots of exotic as never before in my life. And I'm very happy about it because it's definitely, as you said, Elisabetta, challenging, but also it gives you a lot of, you know, good feelings, because if you can achieve to have good outcomes, and also especially with patients, ASA4 critical patients, it really makes you feel that you've done a difference, no? So you make a difference. So it's really nice. Then of course they try and die. They tend to die as much as possible. We try to prevent it, but yeah, I really like it. So let's say, and I was asking you about the butane because I started to use it for ASA4 patients, especially for liver lobe torsions. And I actually found that it helps with the blood pressure and with the contractility of the heart at very high rate compared to dogs and cats. But again, maybe this is something that we will look into in the future, no?
Yeah, good.
Thank you, Elisa, for your comments. I think you are one of the fewest residents in anesthesia that has the privilege to work with so many exotics, no? Because as I was mentioning, you guys struggle sometimes to have caseload with exotics. And yeah, this is amazing.
Yes,
Great.
I'm very lucky.
I think we have to invite Paolo Selleri next.
Yeah.
I can ask me. He'd be very happy.
Yeah.
Sure.
Yeah, because there are, so in all the webinars are always, but apart from the fact that I'm a surgeon, and I should not say that, but I'm a bit bored by the surgery topics, and I'm more interested in following other disciplines, so anesthesia, oncology, medicine, because surgery more or less is my everyday bread. So, and I'm super happy to have speakers presenting topics that are completely something that I don't know, I'm ignorant about. So if how is his name? Paolo Selleri. If Paolo Selleri,
we can ask him to speak about endoscopy in reptiles.
Amazing. So it would be, it's just, so we need to keep in mind that the webinars that we do are, yes, by the vets, but for the vets. So it must be things that are approachable in the everyday practice. So like what Elisabetta did today is amazing, because in the general practice, they do have to anesthetize rabbits for, you know, simple spay or chiectomies, and yeah, I think it's very useful what Elisabetta has brought today to her knowledge. So thank you, Elisabetta.
Thank you.
Thank you.
No, I don't understand this question, Paolo. So I think I don't know what you mean with that. So, Elisa, when are you going back to Italy?
The end. I finished my period here at the end of July.
Okay,
So
and then
the
are you
beginning of
coming back
August.
to the UK or not?
Next year. Next year for a few months. Yeah.
Yes, guys, I think this has been an incredible session, I must say. So nearly 2.5 hours with much participation, and I think I'm very, as I said, Elisabetta, you know, I'm a very big fan of you for what you do. And David, I met you the first time over the weekend, and I'm very grateful that now we know each other, and I hope we will stay in touch in the future.
Yes, of course. Yeah, with pleasure.
And Elisa, we work together, so yes. I will see you tomorrow.
Exactly.
and so I would say thank you to everyone that has joined us today. Thank you for the questions. Thank you for the donations. And if you haven't donated, please just give us a little bit to help our fundraising, and share the link. And we our next talk should be on internal medicine with Yaisa Forcada, and she will talk about IBD in cats. I still don't know exactly the date, and it will be the 20th webinar. So, and the good news is that now many specialists are from the United States are coming back to me and giving their availability to do talks. So I think we will be here in the long term with possibly one webinar per week or one webinar every 2 weeks. But now we have reached the other side of the world, so it's amazing. This veterinarian community we are great. We are a great family, and what I love about that is we in this specific circumstance there is no competition. We are just all together, united to help other colleagues and other people needing or in difficulty. So, and this is great what we are doing, and I thank you for your participation and for your help. I think I'll let you all go. Thank you so much. Thank you really for everything, for being here, for your help, and for your
thank you.
Amazing.
Thank you very much, Daniela.
Thank you.
Thank you, guys.
Thank you very much.
Bye.
Bye. Good night.
Watch the final video about Alexi. Bye-bye.
Goodbye. Bye-bye.
Bye.